Hello, my name is Leah Berg, and this is my DOCC assessment. Good morning, Mr. Smith. I'm glad you came in today. Is it okay with you? I'd like to perform a physical exam and ask you some questions about your health. Please let me know if you have any questions and need to take a rest at any time. For your safety, I'd like to confirm your full name and your date of birth. Can you tell me that information? The patient has responded. My name is John Smith. My birthday is 6/1/1941. Thank you. And Mr. Smith, how do you prefer to be addressed? Mr. Smith has responded, John. And can you tell me what brings here today, John? John replies, I'm here for a checkup for my AFib. I'm using this information not only to confirm Mr. Smith's identity, but also to assess his level of consciousness. He has demonstrated that he is alert and oriented to person, place, time, and situation, or otherwise known as A&O times 4. John, are you in any pain today? John has responded no, but his feet feel tingly. I've assessed his pain. If he was in pain, I would ask him to rate his pain on a scale from 1 to 10, as well as to describe his pain. As I'm conversing with John, I'm also assessing his general appearance. This assessment includes his general hygiene, dress, his mood, his behavior, his affect, his overall overt nutritional status, his posture, his basic mobility, stature, and any signs of distress. And I'm observing that John is a well-kept man who appears his stated age. His mood, behavior, and affect appear appropriate for the situation. He appears overweight, and he walks with a shuffling gait. He uses the backs of chairs to steady himself as he passes, but he is in no apparent distress. When John came in today, our medical assistant assessed his vital signs. John, our medical assistant measured your vital signs when you came in today. Do you have any questions about them? John has responded, no, that's about what I run. His height is 174 centimeters or 68.5 inches. His weight is 109 kilograms or 239.8 pounds. His BMI is 36. His temperature is 37 degrees Celsius or 98.6 degrees. His blood pressure is 149/98. His respiratory rate is 20. His pulse oximetry is 92. His heart rate is 120 beats per minute. And so now we'll assess the history of his present illness and his symptom assessment. John, can you tell me about your AFib symptoms? He's responded, my heart sometimes feels like it's racing and I get dizzy. Can you tell me how often this happens? John says, a few times a day. How long does it last when it happens? A few minutes. Does it happen at the same time every day or when you're doing a particular activity? John responds, no, it just happens sometimes. How bad are the symptoms? Do you feel faint when you are dizzy? Have you ever fallen? John has responded, sometimes I feel like I get tunnel vision when I get dizzy. I've fallen a few times if I can't get to a chair to sit down in time. John, does it seem like anything that makes it better or worse? John responds, I don't know. If I'm feeling good that day, it seems like it isn't as bad. If I'm tired or don't feel good that day, it's harder to handle it. John, do you feel that this is the same as it's always been, or has it gotten better, or has it gotten worse? John's responded, it's pretty much the same, but I'm more tired now, so I get dizzier. To gauge the impact of these symptoms on John's daily life, I'm using the modified Rankin scale. John scores a 2 on this scale, indicating slight disability. He's unable to carry out all previous activities, but he is able to look after his own affairs without assistance. As part of this assessment of his symptoms and a history of present illness, I've assessed the location, duration, timing, quality, severity, signs and symptoms, context, and mitigating and exacerbating factors. John, do you have any allergies to medications, foods, or the environment? John has responded no. John's current medications include a Lantus insulin pen subcutaneously on a sliding scale, loperamide 4 milligrams once daily, atorvastatin 40 milligrams once daily, metoprolol 25 milligrams once daily, lisinopril 5 milligrams once daily, aspirin 81 milligram chewable tablet once daily, and a multivitamin. We'll assess his past medical and surgical history, as well as his immunization status next. John has a past medical history of atrial fibrillation, chronic kidney disease, which was stage 3 last time he saw a nephrologist, but that was several years ago, diabetes mellitus, type 2, hypertension, and hyperlipidemia. His surgical history includes a cardiac angioplasty and stent placement ×3 in 2011. In 2001, he had a cystoscopy with kidney stone extraction. In 1989, he had an open reduction internal fixation of his left distal radius fracture. And in childhood, he had a tonsillectomy. However, he does not remember the exact date. For John's immunizations, his last flu vaccine or influenza vaccination was October of 2016. His pneumococcal vaccines were in 2016 with a booster in 2017, and his last tetanus shot was in 2016. John, do you get your flu shot every year? John responds, yes, we usually get them at Sam's Club. We skipped it this year because we heard that they didn't do any good. Next, we'll assess John's family history. John, is it okay if we discuss your family's health history? John has responded yes. Based on the history of the form that you filled out, I have the following information. You have 2 living sisters and 1 deceased brother who died at 59 of heart problems. The patient's mother died at 68 of breast cancer. His father died at 71 of a stroke. The patient reports that his children are generally healthy, however, his son takes heart pills. He's unaware of what the medication is or what it's for. John's personal and social history is next. John, I understand that you are currently married. Can you tell me how long you've been married? John responds, more than 50 years. And currently, you're retired. What did you do before you retired? John has responded, I worked for the railroad managing the rail yard. John, who do you currently live with, and do you feel safe in your home? John says he lives with his wife. His kids are all grown and have moved out. He feels fine at home, but his acreage is a lot to take care of now. And John, are you currently smoking? John replies that he doesn't currently smoke. He quit smoking 10 years ago. However, his wife still smokes, so he is exposed to secondhand smoke. John, do you currently drink alcohol? John responds, I drink 3 to 4 beers each night. Do you use any drugs that aren't prescribed or what could be considered street drugs? John replies, no. Next, we'll discuss John's wellness activities. John, do you do any form of exercise? John responds, I'm active taking care of my property, but I feel more tired than a year ago. I do less now because I get tired. I gained 40 pounds in the last year. John, do you perform self-exams, such as testicular exams, or looking for changes in your skin markings? John responds, not really. Do you do anything to take care of yourself that you enjoy or that helps you relax? John responds, I used to fish, but I don't get out much anymore. I have trouble getting the boat on and off the trailer. Now I drink beer to relax at night. John's common risk factors include hypertension, chronic kidney disease, diabetes, obesity, tobacco smoke exposure, and alcohol use. These are all known to exacerbate atrial fibrillation. John, you filled out a form when you came in today to tell us about how you were feeling. Is it okay if we talk to you about that a little bit? John's form was the PHQ-9 psychological assessment form. John has responded, yes, it's okay if we discuss it. I see that you checked the areas talking about sleep, feeling tired, and feeling like you're a burden. Can you tell me about any problems you have with sleep? John responds, I get up to go to the bathroom in the middle of the night and I can't get back to sleep. I go sit on the couch and watch TV so I don't wake up my wife. How about feeling tired? Do you feel like you feel more tired than you did lately? Are you not getting enough sleep? Or do you think that it's more that you get tired from activity? John has responded, well, I'm tired from not sleeping, so I sit in my chair during the day and I take naps. Or if I work outside, I come in and I sit in my chair and I fall asleep. John, you mentioned that you feel like a burden. Can you tell me about that? John has responded, my health problems make it hard for me to keep up with things, so my kids have to come and help more now. I'm worried if I have a stroke, my wife won't be able to take care of me and I'll end up in a home. John, is it okay if we assess your spirituality and your social group? John has responded, yes. John, do you have a spiritual belief system or do you practice a religion? John responds that he attends the Methodist Church. Do you use your church as a support system or your spiritual practices to help you cope with difficult things? John replies, the church brings meals to people who need it, but we don't do that. I pray sometimes, but my wife does most of that. Most of the people we know go to the same church as we do. So John, it sounds like you have a social circle at the church, and there are options for some support if you ever need it. Do you feel like that's right? John responds, yes. Do you feel like you have strong social connections? Do you ever experience loneliness? John responds, no, we play cards a few times a month with people from church, and the kids and grandkids are around quite a bit. Now I'm going to start John's neurological assessment. John, if it's okay, I would like to start our head-to-toe assessment. Let me know if at any time you have questions or you need to rest. John has responded okay. A quick neuroassessment is the Glasgow Coma Scale. Because I've been conversing with John, I know that he is scoring a 15 out of 15. He is alert and oriented ×4, he responds to verbal commands, and he opens his eyes spontaneously. I will also use the NIH stroke scale, but I will be applying it throughout the exam to promote efficiency. It is important to use this scale in atrial fibrillation because it increases the risk of stroke, and this allows us to have a baseline for patients. I will complete the stroke scale throughout this, and I've already assessed his level of consciousness, orientation, and ability to follow commands. He's also able to converse appropriately and is not just demonstrating any aphasia. First of all, I'm going to give him a picture to look at and a list of sentences to read for me. Does that sound okay, John? John has responded yes. Here's a picture. Can you tell me what is happening in this picture? John responds, Mom is washing dishes in a flooded sink and the kids are taking cookies. Here's another picture. Can you name some of the things in this picture for me? John is responding, a key, a glove, a chair, a feather, a cactus, and a hammock. And John, can you read these sentences? John has responded, you know how, down to earth, I got home from work, near the table in the dining room, they heard him speak on the radio last night. And finally, John, can you read these phrases for me? John has responded, Mama, tip-top, 50-50, thanks, huckleberry, and baseball player. Assessing these allows us to assess for different types of aphasia as well as dysarthria. I've used these tests as part of the NIH stroke scale. John, I'm also going to ask you to bare your teeth for me. John has bared his teeth. And then frown, raise your eyebrows, close your eyes, stick out your tongue. John has performed all of these. All of these movements are symmetrical. I'm assessing several of his cranial nerves and a component of the NIH stroke scale by asking him to do these things. John, I'm going to ask you to close your eyes and tell me whether I'm touching you with something soft or sharp. John is closing his eyes. I'm going to touch his side of his face, both with a cotton ball and with the side of a cotton swab. And John has answered correctly that I'm using sharp and dull items throughout his face. I'm also going to assess this on his wrists, and he's answered this correctly. When we move down to the lower parts of his body, I'll be assessing this on his legs as well, but I want to go head to toe. John has answered all these correctly. As part of his HEENT, or head, eyes, ears, nose, throat, and neck, I'm going to be moving in a head-to-toe assessment. To start out, I'll ask John, if he has any headaches, dizziness, or times when he feels faint. John responds that sometimes he feels dizzy when his heart races. I'm going to start by doing a visual assessment. I don't see any changes, but I'm also going to feel his scalp to see if there are any lumps, bumps, or sore areas. He recently had an optometry appointment, so I won't assess his vision, but I will assess his visual fields by having him look at me and tell me how many fingers I am holding him up in his peripheral vision. Finally, I will look at his eyes to assess for any discharge, redness, or changes. I will use this visual assessment to complete the gaze component of the NIH stroke scale. His horizontal eye movements are all within normal limits. So to demonstrate, I will be having him look at me, and I will be asking him how many fingers I am holding up in his peripheral vision. John has demonstrated that effectively. John, I'm going to move to your ears. Do you feel that your hearing is about the same as it was last year? And do you wear hearing aids? John has responded, my wife says my hearing's worse. I wear my hearing aids most of the time. I'm going to visually assess his external ear for any changes, and then I will look in his ear with an otoscope to look at his eardrum. I will be looking for redness, discharge, or bulging of his tympanic membrane. John's hearing aids are managed by his otologist. I will ask him if he has an upcoming appointment. If he desires an appointment, we can coordinate the care with front desk and have them get scheduled at a time that works for him. I will now be looking in John's ear with my otoscope and assessing his tympanic membrane. I have observed no abnormalities in John's ears. John, I'm going to look in your nose. Sometimes this makes people feel like they have to sneeze. Do you have any problems with nosebleeds, sinus pain, or runny nose? John has responded, my nose doesn't bleed now that I'm off the Coumadin. To assess his nose, I'm going to look up his nose with the otoscope that I was using before. I'm assessing for patency and discharge. I will assess the patency of his nares by alternately blocking one side of his nose and having him inhale and exhale alternately. I'm seeing no redness, discharge, or problems with John's nose, and he's demonstrating full patency. John, let's talk about your mouth, your neck, and your throat. Do you have any problems with sore throat or swelling? Do you feel like your voice has changed? John responds, no. Have you been to the dentist recently? Do you have dentures? If so, do they fit okay? Do you feel like you can eat adequately with them? John's response is that I have top and bottom dentures. They feel fine. I go to the dentist because Medicare pays for it. I'm going to look in John's mouth. I'll be looking for dental health and the condition of his oral mucosa. I'm assessing his tongue when it extends midline. I'm looking to see if there are any sores or dental concerns. Because John has a full set of dentures, I'm not assessing for dental caries. However, I am assessing for dental health. John has a history of smoking and consumes alcohol, which are both risk factors for head and neck cancer. I need to pay special attention to make sure there are no sores or lumps that I can see. So when I look in John's mouth, I see that he has his dentures in, and I see no signs of any sores, lumps, or bumps. I'm going to palpate John's neck to feel for enlargement or bumps, especially around his thyroid. I'll be checking for asymmetry. I also will assess to make sure that his trachea is midline, and I'll have John swallow so I can feel for any lumps or deviations from normal. I feel nothing abnormal in John's neck. I will also be listening to John's carotid arteries to assess for bruits. This can indicate a carotid stenosis, and he may need to be evaluated by a physician. I hear no bruits bilaterally. I will be assessing John's integument with each section of his body that I cover to promote efficiency. Next, I will be assessing John's chest, his heart, lungs, and cardiovascular system. John, I'm going to move on to your heart and lungs. When I listen to your chest, I will have you take several deep breaths. Let me know if you start to feel dizzy, tired, or need a rest. John has agreed. I will start by doing a visual assessment of John's chest. I'm looking for equal and bilateral chest expansion when he's breathing. I'm also looking for any abnormalities, previous surgical sites, or presence of pacemakers or ports that may not have been mentioned. I'm inspecting his skin by looking for sores or discoloration or bruising, or suspicious moles or lesions. I'm also palpating to feel for any bony prominences, lumps, tender areas, or symmetrical chest expansion. John, I'm going to listen to your heart and lungs. Please let me know if you feel dizzy or need to rest while taking deep breaths. I'm going to start at the top, listening to his apices first, and move down, and then I'm also going to do a posterior listen. While I'm listening posteriorly, I'm also going to be listening for his posterior heart sounds. And then I'm going to have him lean back, and I'm going to listen to his anterior heart sounds. As I'm auscultating in his chest, I'm listening for his lungs, for any wheezing, ronchi, crackles, or wetness. I'm listening to his heart for the normal lub-dub, S1 and S2 sounds, and also the presence of any murmurs or anything that is not normal. If John had a prosthetic valve, I may be hearing the clicking of the valve opening and closing. I don't hear anything abnormal other than noting the fact that John's heart rate is quite elevated. John, let's move to your belly. Have you ever had any changes in your appetite, experiencing heartburn? Do you have anything that bothers you? Have your bowel habits changed? Are you regularly constipated or regularly experiencing diarrhea? John responds, tomatoes give me heartburn. John, I see that you've had a colonoscopy 5 years ago. It was negative. You're up to date on your colorectal screening. If you notice a change in bowel habits or bleeding, please make an appointment as soon as possible. John, if you don't mind, I'm going to ask you to lay back. This will help me get a better look at your belly. I am beginning the assessment by visualizing John's abdomen for any signs of obvious deformities as well as his integument. Umbilical or ventral hernias may often be noticeable in this section. I'm then going to move to auscultation. I'm going to do that before palpation because I don't want to initiate any bowel sounds I wouldn't normally hear. Finally, I'm going to do palpation and then percussion. I don't see anything on his body that I would notice as abnormal. I'm going to listen to all 4 quadrants for bowel sounds. I'm palpating, first shallow and then deep palpation, and I can feel the border of his liver, but nothing abnormal. And finally, I'm percussing. I don't hear anything abnormal. Before John sits up, I'm going to have him roll onto his side so I can assess his flanks and his kidneys, as well as look at his back. I see nothing abnormal on his flanks, and I feel nothing abnormal for his kidneys. I'm feeling and palpating John's suprapubic region, which is to assess for pain or masses in his genitourinary system. When I felt his kidneys, I didn't feel anything, and there was no pain or masses. John, I'm going to ask you some questions about your urination. Are you having any pain with urination? I see that you had a kidney stone in the past. Have you had any further issues with that? What color is your normal urine? And is there any blood in your urine that you ever notice? Do you feel like you have to go to the bathroom more often than normal? Do you ever have trouble making it to the bathroom? Do you have sores or discharge in your genitals? John has responded, no pain other than kidney stones. I go to the bathroom a lot, more at night. My urine is usually pretty dark. No blood since I went off the Coumadin. I don't have trouble making it at night, but I have to get up a lot. No sores and nothing odd. As I assess the GU system, I'm asking about pain with urination, hematuria, incontinence, urine color, frequency, sexually transmitted diseases, signs and symptoms. John has chronic kidney disease, so that is something that I'm noting. Okay, John, as he lays back, I'm going to have him hold up each leg for 5 seconds. As he holds this up, I'm assessing that he's able to place his heel on his shin and alternately on the other side. This helps me assess for his NIH stroke scale as well. John, as I ask you to sit up, I'm going to look at your arms and legs. I'll ask you to move them for me and also for you to walk for me. If you feel any pain and feel unsteady, let me know right away, okay? John has responded, okay. I'm going to start with a visual assessment. I'm looking for abnormalities, deformities. I'm also assessing his skin for lesions and abnormalities. Finally, I'm looking at his fingers and toes to look for clubbing. I'm assessing capillary refill on his fingers and toes, and this is helping me evaluate his peripheral vascular system. I'm also palpating peripheral pulses. If I'm not able to palpate the pulses, I will Doppler them to be able to feel them. John, do you have any joint pain or problems, any stiffness? Are there any movements that are difficult for you? Do you have muscle problems like cramps or weakness? John responds, I'm stiff in the morning. Sometimes I get a Charlie horse at night. John, can you move each arm in a circle for me? Do you have any pain with movement? Okay, now I'm going to ask you to try and pull my arms towards you and then push my arms away bilaterally. This is assessing strength and bilaterally in his arms as well as range of motion. Finally, I'm going to have you hold up each arm in front of you for 10 seconds. I'm assessing in this for drift, which is part of the NIH stroke scale. And I'm going to have you reach with your index finger, touch my finger, and then touch your nose. This is also a portion of the NIH stroke scale. It's helping me assess his proprioception. I'm using this test to assess upper extremity range of motion. John, can you extend each leg for me, please? Do you have any pain with movement? Can you push my arms up? And now pull them back down. Excellent, thank you. I'm using this test to assess his lower extremity range of motion and strength. I am also looking for any signs of venous stasis, ulcers, skin alterations. I'm checking his peripheral pulses, capillary refill, and then I'm going to have him get up and walk for me. John, do you feel like you can get up and take a walk to the other side of the room, turn around and come back? If you feel unsteady or like you need to rest, please let me know and I will help you. I'm assessing John's gait and further range of motion. He walks with a shuffling gait and used the back of the chair to steady himself for support. I'm using this information gathered here to complete the Morse Fall Risk Scale. John has a history of falling last year, which is 25 points. He has multiple secondary diagnoses, 15 points. Uses the furniture to steady himself while walking, 30 points, and does not have an IV in, which is 0. He walks with a shuffling gait, 10 points, and his oriented times 4. His total score is 80. Scores over 45 indicate a high fall risk. Finally, I'm taking a closer look at his feet because he said he had numbness and tingling. I want to assess whether this is diabetic neuropathy or if this could be claudication problems because of peripheral vascular disease. Do you ever get sores that you don't notice right away? Do you have trouble getting down and taking care of your feet and trimming your toenails? Do you feel numb and tingly today? John has responded, I sometimes have a sore and I don't know how I got it. I feel a bit tingly in my feet today. I usually have to wait for my wife or one of my kids to get to my toenails. I'm seeing no sores, also no clubbing of his toenails. However, his toenails are significantly overgrown. I'm having difficulty palpating his dorsal pedal pulses, so I will Doppler for these pulses. As part of a comprehensive assessment for atrial fibrillation, we fill out the CHA2DS2-VASc and HAS-BLED screening tools. These tools assist in determining the risk of stroke or bleeding event and will allow the patient to have a discussion with their healthcare provider. In this instance, John is scoring a 4 on the CHA2DS2-VASc scale, indicating that he would benefit from anticoagulant therapy. However, that's not an option for him because he has a history of a GI bleed. John's scoring on the CHA2DS2-VASc scale is based on hypertension, he's over 75 years old, he's diabetic, and age actually accounts for 2 points, so that is 4 points. The other scale we assess is the HAS-BLED scale, which assesses his risk of a bleeding event. So John has a 5 on the HAS-BLED scale. Indicates that he's at risk for a bleeding event. This is because of his abnormal renal function, as we know he has chronic kidney disease. He's had a past bleeding episode with his GI bleed, as well as episodes of hematuria. His age is over 65. He is on an antiplatelet medication with his aspirin, even though he did come off of his anticoagulant medication. And he has significant alcohol use. This totals to 5. He would have a yearly bleeding episode risk of 12.5% as an estimation. So, after all these assessments, John obviously has some issues to discuss with his provider as well as some follow-ups to make. This will be an opportunity for the nurse to work as a care coordinator, coordinating with nephrology, otology, and any other of the clinics that he would need to be a part of. We would also be evaluating him in this instance for a Watchman device because he is a risk of blood clot and stroke, however he is not able to be anticoagulated. John, thank you very much for participating in the assessment today. Do you have any questions or do you have any concerns that you would like to discuss? John has replied no. Thank you very much.